Hello LovelyyOT, teacher girl Nancy. I'm back again with another video. Now this video we are going to talk about alternative careers for us OTs. And of course it can probably apply to all the therapists, speech therapists, physical therapists. So if you are interested in this video, please stay tuned and I'll be right with you. Before you watch my video, why don't you just hit that subscribe button? That red button right there. Right there. Come on, hit it. I know you want to. I know you can. I know you want to. I know you can. I know you want to. Okay. No, seriously, do it. I did a lot of research, okay? And so these lists are, some of them are lists that I saw on the internet. Some of them are lists that I came up with myself, okay? So let's go. So the first one that I thought about, this is such a cool idea, right? Imagine opening your own dance studio for people with movement disorders like Parkinson's. Even if you don't have a movement disorder, anybody with like fall risk could benefit from this. Balance issues could benefit from this, because sometimes I do dancing with my therapist at the skilled nursing facility, especially if I know the patients have the ability to move and stuff like that, and I encourage them to do side step, back step, forward steps, turning around and stuff like that. Those things are really good for your balance, dynamic balance. Dancing is basically like having dynamic balance. So this is definitely a phenomenal idea in the basics of therapy, to have a dance studio just solely focusing on movement, having that smooth movement, you know, doing your little salsa, doing your little like back to step, one side step, okay? So I think this is a really cool idea. I am absolutely, definitely all hands up, hands down, all of it. I'm in it. I love that idea so much. You guys have probably heard this a million times, is to have your own yoga studio. Now yoga, of course, there's so many different research about the importance and the benefits of yoga, and how yoga can really improve a lot of different things for you. It can make your bones stronger, it can stretch your muscles out. If you have arthritis, back pain, there's so many different benefits for yoga. So being a yoga instructor and incorporating your yoga skills with your therapy experience and all that, and actually improving people's lives, decreasing of chronic pain, because of course with yoga also comes breathing, which breathing is so good, especially for people with COPD. If you have depression, stress, breathing is a phenomenal thing for you. So hands down, having a yoga studio is absolutely phenomenon. The next one, which is my personal favorite, is definitely pain management clinics, okay? With the rise of opioid abuse and different drug abuses, really, having something in place that would teach people different pain management skills and different modalities that you can use to decrease your pain and manage your pain, even if it's teaching them about breathing, teaching them about like different problem skills and different things to do when you're in pain, versus going straight for the medicine and pills and all that stuff. To just have this pain management clinic where people come to be educated and definitely find alternative treatments to reducing or managing their chronic pain. And if you haven't thought about it already, ching, 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 okay? The next one that I have on my list is to be a corporate coach, okay? And what can you do as a corporate coach? What are you going to be doing? So basically, it's kind of like those occupations in the occupation that people always think that OTs do, and that's it. Basically going to different companies. It could be like McDonald's, it could be a supermarket, it could be really anywhere where people with developmental disabilities work at, and your job would be to help them come up with different ways, problem solve with them, to come up with different ways for them to be able to still keep their job, maintain a paycheck, and just having different ways to do things. The number one thing that people usually ask me when they meet me is, what do you do, or what did you go to school for? And so having that advocacy for people with developmental disability, to also empower them so that they can also earn their own checks and be able to keep a job. Just because someone have a developmental disability, that they shouldn't have a job or keep a job. I think that it's our right and it's their right to be able to say, you know what, I want to be able to go and apply for a corporate job and be able to get that job. And then us corporate coaches will step in and find ways and means for them to still be successful just like everybody else. Corporate coach idea is absolutely amazing. Alright, the next one on my list is to have your own community center. And this community center idea, I've actually volunteered in a community center before when I was in grad school, and it was absolutely amazing. That community center was basically for the geriatric population who were still living in the community but needed something to do during the week, and also for kids, after school programs for kids who maybe were going through a tough time with their family and stuff like that. It was just like a safe haven for them to come and get help with their homework, do different crafts, meal preps, like different games and stuff like that, to kind of like help them increase their quality of life all around and just not in school. The geriatric population had the pleasure to do some cooking groups. We had bingo, we had different games that they could participate in, and it was absolutely amazing. So having a community center like that is absolutely all us, okay? It's all OT, absolutely 110%. But not only that, different people can also benefit from this. Definitely people who are homeless, people who may have maybe war veterans who may need help to get back in the job force. Definitely people who have out of jail, maybe on probation, that still need help to navigate around the system a little bit. Maybe even women who need shelter. There's a whole list of people who can definitely benefit from a community center. And definitely some of the things that we can teach them is finding a job, hygiene and grooming, meal preps, getting them ready to build a resume, interview skills, how to build good relationships, how to stay away from drugs and alcohol, education about the different things out there and the different laws and things like that, helping them navigate the system to get a job, to get an apartment, to get a car, to get a bank account. You know, the little things in life that we take for granted. There's a lot of people who do not have access to this. So having a community center that can be there for people to come to when they need these kind of skills and help is absolutely amazing. I know that they do have these there and available, but I definitely know that a lot of OTs may not be applying to these jobs because, one, they probably don't pay them that much. A lot of these places that I've come across are usually non-profit places that don't pay that much, and I don't know why. I mean, like, it's very important for people with mental health illnesses, people who are homeless, people who need help, to be able to have a safe place to go to get that help, and for someone to just be there to guide them along the way. It's just as important as someone who's in the hospital and they need therapy, I think. Okay? Architecture consultant is my next one. And this is so cool because what it does is that it allows us OTs and probably PTs to be able to work with different architectures who build like parking lots and parks and community playgrounds and stuff like that, and basically trying to make them accessible for people with mental disabilities, physical disabilities, anybody to have access to these places. It could even be like how to design a supermarket for inclusion, the increase of inclusion, to allow people, regardless of your physical or mental disability, to be able to go wherever you want to go and to be able to participate in your daily activities. I don't think that just because that I'm sitting in a wheelchair should prevent me from being able to reach up top to grab something. If we can make certain supermarkets or certain sections of the supermarket inclusive for all people of all types to be able to have access to things. Definitely even something as simple as making some of the labels big enough so that people who have low vision can be able to see what they're reading, to be able to read the labels, because certain labels are so super tiny. Definitely, or even having a place in the supermarket where they can go and get like magnifier glasses, things to wear or to look through so they can read labels. Just having different things in place for people of all ages and sizes diseases and illnesses, disorders and stuff, to be able to feel like they are being included into the world and the things that we do. And as always, please don't forget to subscribe, okay? Hit the notification button so that you can know when I upload a video, which is going to be every single week, okay? Thank you guys so much for watching. I love you guys so very much from the bottom of my heart. Until next time, love you. Bye.